It is known that these medications can affect the moods of women. What happens is we use these injections called as gonadotropins, which help with ovarian stimulation during IVF. And when we use this, hormones tends to go high. Similarly, there are some progesterone medications that might be given after embryo transfer, which help in proper implantation of the embryo. These medications are known to affect the mood. I have come across some women talking about heightened sensitivity, getting irritable easily, having nervous background, getting angry on people, getting frustrated. These are all common mood swings that are known to happen during treatment or even during the waiting period when one is waiting for the pregnancy outcome. It's important to acknowledge this. Having a mindful attitude towards it, being aware that such a thing can happen, itself helps in win the battle. It's very important to journal and have a track of how the patterns are, what triggers the mood swing, and writing this down actually can help in coping with it. It's also important that women could practice some amount of breathing exercises and meditation, because meditation tends to calm the mind and give a little perspective towards the outcome of the treatment. It is very natural that these mood swings can happen. Now, whether it is because of the fact that one has undergone a major treatment and awaiting results that causes the mood swings, or actually medications lead to mood swings, difficult to ascertain and come to a conclusion with it. But however, managing it would include being mindful about it, being aware about it, getting into some amount of simple yoga and meditation, and finally, if it is in a very severe form, seeking counseling and therapy. These things help in coping with it. Fatigue is also one of the common symptoms during fertility treatment, and it's very difficult to say whether it's because of the medications or it's because of the stress of the treatment that women faces this. But however, coping with it should include a regular light exercise, having a good balanced nutritious diet, which would include a lot of proteins, complex carbohydrates and vitamins in the diet. Hydrating well is also one of the important factors, wherein they should consume at least 2 to 3 liters of fluids and good amount of sleep. These things help in overcoming fatigue during treatment. During an IVF treatment, we need to understand that the ovaries are more than what they actually usually are in size-wise. So they almost reach about 3 times or 4 times the size what they would be in a baseline. Now, this increased size in the ovary, in addition to increased hormones in the body, tends to cause a lot of bloating sensation, nausea, and physical discomfort, especially around your abdomen. So dealing with this would include for women to have a little bit of exercise, not intense exercise, having exercise in moderation, hydrating well, which means at least 2 to 3 liters of water and water-based products, having good nutrition, making sure that they have the right diet. It's also important to avoid oil and sugar during this time, because these things tend to exacerbate nausea and vomiting associated with the procedure. And at the same time, if in case all these measures are not helping them out, it's important to seek out to the doctor, because there are medications that will help. At the same time, it's also important that, the way one dresses, maybe you can give a little more importance to it and have loose-fitting clothes during this time, because that also helps in reducing the pain or the discomfort associated with bloating. Well, yes, not everybody, but some women may face brain fog or, inability to concentrate during IVF treatment or during the embryo transfer phase. This could be associated with the high hormones and the fact that some women may feel IVF treatment to be overwhelming because of the number of visits, injections, scans, etc. associated with it. It's important to acknowledge it. If you feel that you're not able to concentrate, it's important to have measures in managing it, which could include that, if you have a huge task to do, break it down into several small tasks and accomplish one at a time. It would also include a frequent break from, working hours. Say if you're working for 8 to 9 hours, have a break every 1 hour to make sure that you have some clarity of thought. It's also important that, you can make use of these digital lists or taskmasters that can actually help you writing down your tasks and getting them accomplished one after the other. So dealing with it is in our hands. It's important that one has to acknowledge it and take productive action towards dealing with it. It's not an impossible thing, but however, if it still feels overwhelming, one could consider taking off from work. It's usually a matter of couple of days wherein, this symptom can be there. So taking a holiday during that time can help dealing with it better. Extremely common question. Yes, everybody tends to ask, do I now start taking bed rest and things like that? Definitely, bed rest is not something one should consider. Regarding exercise, how much can I do is the next question. It's important to acknowledge that when somebody undergoes a fertility or IVF treatment, it usually goes for about 9 to 10 days. It involves injections starting from day 2 and then goes on for 9 to 10 days. Up to 4th or 5th day, there is no risk as such towards any form of exercise. But once the ovaries start increasing in size, it's very important to refrain from any high impact exercises like jumping around, skipping, gym activities that increase intra-abdominal pressure, or dancing, Zumba, aerobics. All these things tend to cause the ovary to taut. So it's important to refrain from all this. So what exercise can I do? Yes, you can walk, you can have a stroll, but make sure that you don't jog or you don't run. Having a stroll for how much of a duration is not a problem, but jogging and sprinting can actually cause the ovary again to, be more mobile and cause discomfort and pain. So modest amount of yoga or possibly a stroll should be okay during the stimulation, but it's important to be away from any intense form of exercise during fertility treatment, especially IVF.